Hello, I'm Rebecca and I'm the therapy lead for Transfer Care Hub here at Blackpool, Victoria. So I want to talk to you about some of our services that we have that allow our patients to return home in a safe and timely manner. So we know that home is best for our patients, and we know that patients are able to recover better in their own environment. So one of our services is called Homes First, whereby we get a patient home and we assess them in their own environment, and then we look at, looking at package of care they might need, or they might need equipment. Homes First consists of nurses, occupational therapists and physiotherapists, so it's a really good MDT team. We are looking to increase the service, and hopefully we'll get more allocated slots to get more patients home on that pathway. In addition, with the Homes First service, they can signpost the patients to other services such as ESD or rapid response, whereby therapists can progress that patient at home so they are never left without any follow-up. So, they can have a social worker follow-up within 3 days as well as that therapy input. So a really good full assessment within their own environment. Another pathway one is Homes to Assess, which is basically a package of care at home. So we get that patient home and we get a package of care in place, and again that is assessed within 3 days of that patient being at home by a social worker, just to see that it's appropriate for that patient if there's anything else that we need to put into place. The therapy that you can have at home, obviously I spoke about early supported discharge team, again, which is an MDT team whereby the therapists come and progress you in your own environment. Another service that we have that we can offer our patients at home is rapid response. So again, this is a service that can provide alternate care provisions, and they can also prevent hospital admissions and facilitate early discharge from the hospital, which is obviously excellent for our patients. We also have the falls team. If a patient has had a fall at home, we can get this team to go in to prevent any further falls and prevent any hospital admissions in the future. So again, that's a therapy team that can come and prevent the falls at home. We also have different community input. Again, we have the neighbourhood care teams and we have the EPC care teams, which again are a multidisciplinary team of consultants, of pharmacists, of wellbeing, physiotherapists, occupational therapists, which again can support you at home, hopefully that you will remain at home and not return to the hospital. We also have the community frailty service. Again, if you have a long-term condition which can include frailty, they can have a 12-week input and provide you with a care plan. Other services we have for Pathway 1s we use are the Red Cross and Age UK, which is transport home, and they will settle you in at home and potentially offer you maybe food services or just wellbeing services or just general support. So all these services will enable patients to be discharged in a timely and safe manner, and also increase the flow throughout the hospital to ensure that patients are going home, but we also have beds available for patients to come into who need that acute hospital input.